Hello everyone, this is your in-service training for meter dose inhalers. So as most of you know, we've been working on a protocol to use MDIs, meter dose inhalers, as opposed to nebulized medications to try to avoid the amount of aerosols to protect ourselves as healthcare providers. There are a few components to this setup, but it's a little different than what you're probably used to. So we're going to go through the setup and the general procedure, and then Mr. Trey Booth is going to talk about how we're going to disinfect these pieces. So I'm sure you all are familiar with inhalers. So this is an albuterol meter dose inhaler. It has over 200 actuations, meaning that we can depress this and give over 200 actuations of this device, and it has a counter on the back, and you can see that this comes, you can just pull this out like so for disinfection decontamination. But for infection control practices, we have to use a spacer, and MDI inserts into the spacer just like this. Now, we're implementing a common canister protocol, which means that we are going to use this MDI for multiple patients until we run out of actuation. That does pose a problem in terms of cross-contamination and infection control practices, but the data that we could find shows that the chance of cross-contamination is infinitesimally small, and it's even lower if you do very stringent disinfection, or if you follow stringent disinfection protocols and policies which we have developed. So to minimize this even further, we're not only using a MDI with a spacer, we're also using a one-way valve. Now the problem with that is to get it to connect, you can see that it doesn't connect perfectly here. So we did find an adapter to make these fit better. So this PVC piece will slide onto the spacer, and then the one-way valve will slide onto that. Now when you're putting this one-way valve on, it has to be turned a certain way. If you have it turned this way, then the one-way valve will be activated when the patient inspires, so they won't get the medicine. So the side that has the plastic piece goes on the spacer itself. The side that is just a cardboard piece goes towards the patient, and I have drawn an arrow on the one-way valve to demonstrate that. So please familiarize yourself with these. This is the only piece that we are going to dispose of. We are going to reuse all of these pieces after proper decontamination. Now, when I go to put this on here, it doesn't fit perfectly, so we have to modify it once again. I'm not going to tape it, but you can put one layer of tape around this just to make it more secure. So just tape this one-way valve to this PVC adapter that we have. So the general procedure goes something like this, and we want to use this protocol on every patient with influenza-like symptoms to avoid aerosolizing, to avoid getting ourselves exposed to aerosols that could contain the virus. So any patient that you think has influenza-like symptoms, you're going to use the meter dose inhaler as opposed to just an albuterol neb. Now within that protocol, you'll see that we do recommend you give epinephrine, IM epinephrine early, but you should use caution if the patient is older, generally over the age of 55, and especially if they have pre-existing heart conditions. All right, so when you're giving this to the patient, you're going to shake this up 4 to 5 times. Some resources say that you should shake it 10 times, but as long as you shake it vigorously, I don't think it matters a whole lot. So you're going to have the patient, after you shake this up, you're going to have the patient fully breathe out. You want them to expire all of the gas and air in their lungs if they can. You're going to insert this into the spacer. You're going to have them put their mouth around this one-way valve. You're going to depress this and actuate the MDI. Have them inhale fully and hold their breath for about 10 seconds or as long as they can to try to make sure that the medicine reaches their lungs. You can repeat this 4 to 6 times every 5 minutes, but we're doing it one depression at a time or one actuation at a time, as opposed to doing 4 to 6 at once, because let's say the patient misfires. Let's say they try to take a deep breath and they pull it out of their mouth and just expire. They're not getting all of the medicine. So we're doing a single actuation at once, 4 to 6 times, repeat every 5 minutes.
Okay, you made it back to the station after you gave your inhaler. Now we're gonna disinfect it. All that you need is bleach and some water. Make sure you have gloves on. You're gonna take 20 mLs of bleach. You're gonna squirt it in your basin. You're gonna fill this up with water to the 1000 line. And then you're gonna take your inhaler. Just go ahead and put that in the water. We'll leave the canister in there just so we can weigh it down. You're gonna take the spacer, also put that in. And you're gonna take your adapter and also put that in. You're gonna leave this to soak for 3 minutes. Once it's done with 3 minutes, you'll take it out, let it air dry for about another minute. After it air dries, just rinse it off with water and it'll be good to put back in service. Also remember to actuate it after you let it air dry and rinse it. That way you can get all the bleach out of the canister. One last thing to mention, if you have to give multiple treatments, there will be multiple inhalers available on your ambulance, possibly 2 to 3. So